our presentation is going to be on the MTHFR gene mutation. And we're going to go kind of cover what it is, what it means, what the clinical implications are, and kind of a rough outline of what treatment will look like. Just to start, I'll introduce myself. I'm Leslie Brown. I'm a family nurse practitioner here at Piedmont Wellness Center. I've been here almost a year now, and my clinical, as I said, I've been at Piedmont Wellness Center for almost a year. My clinical focus here is on nutritional medicine. I work with many diabetics, those with hypothyroid. I do some hormone replacement therapy. We work with mold toxicity and Lyme disease. Previously, I was in private practice with a focus on nutritional medicine and weight loss, hormone therapy. And prior to that, we still can't hear. Hold on one moment. You need to call the number. Do I need to tell them that? It looks like you need to call the number and use the passcode in order to should have done practice. Can we keep going? Okay. Hopefully we have things worked out here. Okay, and finally, my initial practice as a nurse practitioner was in psychiatry and in family practice. So let's get started on what is the MTHFR. MTHFR stands for methylene tetrahydrofolate reductase. It refers to the gene as well as the enzyme that it affects. It resides on the first chromosome. It has two arms to that chromosome, one that's inherited from the mother, one inherited from the father. There are about 20,000 or over 20,000 different bases on that gene, but the two most clinically significant is what we're going to focus on today. That's the C677T and the A1298C. Let's see here. And of those two alleles, there are 5 potential mutations that happen in various combinations. The most severe of the mutations is the C677T. And then there are variations of others, and the least significant is the single copy of the A1298C. For your information in how common is this mutation, about 40% of the population worldwide has a variation of this gene mutation. So it is not uncommon. And again, the most significant is a double copy of the C677, and the less severe is the single of the A1298. So the question, what does the MTHFR enzyme do? The enzyme is responsible for a process in every cell of the body that involves methylation. Methylation is a process where the cell takes in folic acid and a vitamin B12, and then it initiates a cascade of enzymatic processes. When there is a gene mutation present, then this enzymatic process can't occur, and the enzyme is impaired essentially, and the cell can't function at its optimal. Let's see here. So what does methylation do? That's the question. It plays several very important roles within the body. First being to protect and repair your DNA and your RNA. That's your genetic information. It reduces histamine and homocysteine levels within the body. It protects all your cell membranes. It assists in all cell detoxification processes. And it's very important in producing and recycling neurotransmitters, such as serotonin, dopamine, norepinephrine, and epinephrine. In addition, it helps in the immune system by helping with the production and maturation of red and white blood cells, as well as platelets. The mutated gene ultimately affects the cell's ability to make glutathione. Glutathione is considered the body's master antioxidant, and it's extremely important for the health of all the cells in the body. Without adequate glutathione, every cell in the body is susceptible to damage by means of heavy metal toxicity, bacteria, viruses, toxins that are found in our air, in our water, in our food, and even substances that are put on the skin topically. Because of the gene mutation and its effect on the cell, there are a variety of conditions that can result that are presented medically. Situations like heart disease, stroke, miscarriages, depression, fibromyalgia, chronic fatigue, neurological disorders such as spina bifida, Alzheimer's, dementia, autism, Asperger's, infertility, alcoholism, numerous diseases are associated with this gene mutation. Think of it not as a direct cause, but as an associated factor in the development of this disease. To give you an idea of how, or the degree to which it impairs a cell, a single copy of the C677T mutation decreases the cell's function by about 40%, but a double copy reduces that by 70%. So the cell is significantly impaired in its ability to create energy and to function and do its function properly, essentially. One thing that's important to note, however, is that not all people that have the same gene expression will present the same clinically. Numerous factors are at play when it comes to the expression of gene mutations, and those are primarily environmental. People that live in very clean environments, that have clean intake of their food, that avoid toxins from all different angles, are much less likely to express clinical conditions, whereas those that are in more toxic environments, fortified and processed diets, polluted air, contaminated water, numerous toxins that they're exposed to, they will be more likely to express some of these medical conditions earlier in their life. Clinically, I've seen many men and women in their early 20s that present with numerous symptoms that you wouldn't expect to see until later in life, but they are testing positive for this gene mutation. Additionally, there are other genes that work in the cell that affect the process of methylation. There are about a dozen other genes that are at play here. So the MTHFR is one of those genes. Sometimes further testing is required, and those other 12 can be tested as well. The bottom line is that with any variation of the gene mutation, your cells become less efficient. They're more sluggish. Think of it as a cellular congestion, and the cells being much more susceptible to disease overall. Is there a treatment? Well, you can't change the genes, so they are there permanently. But the good news is there's a great deal that people can do to decrease the toxic load on the body and to feed the cells what they need to function at their optimal. So that's where we have control. Let's see here. So what do you do first? Well, the first step is to know whether or not you have this gene mutation. Screening is recommended. For most people, it's not across-the-board standard at this point, but if you are suspicious, it's a good idea to be screened. Screening is done typically by a blood test. There are some labs that perform saliva testing, but at Piedmont Wellness, we do typically blood testing. Clinically, I test patients that have, when I'm going through a history, that have a significant history of heart disease, stroke, cancers, miscarriages, depression, or any syndromes like fibromyalgia, chronic fatigue. They're great candidates to be screened and typically test positive for this. In addition, mutations here that have numerous specialists that have no definitive diagnosis, that have a collection of sort of low-level symptoms, fatigue, muscle and joint aches and pains, different symptoms that can't quite be pinpointed. They're great candidates for screening as well. And in general, screening is recommended for couples that are looking to have children. Prenatal care is impacted by this gene mutation, and it's very important prior to having children to know whether or not you are positive. And anyone who has a family member who is positive, it's recommended to be tested because it implicates your risk of disease, and it allows you to become more active in your care in terms of prevention. So treatment is multifaceted. There are several approaches to how we render treatment. They are typically done through lifestyle changes and through significant amounts of supplementation. No protocol is the same, however, for all people. There are some individual situations and variations that need to be considered. In general, recommendations include changing the diet. Things like a paleo diet or a grain-free diet are very important because grain-based foods are mostly fortified with folic acid and B12 that individuals with this gene mutation cannot process well. And so avoiding those foods that are fortified and processed is extremely important. The cell cannot handle the wrong form of these types of vitamins. And then it's very important to look at things in our diet or medications that block folic acid. These include antacids, whether they're prescription or they're over-the-counter, oral contraceptives or folic acid blockers, medications like methotrexate. There are several anti-seizure medications and antibiotics that do the same thing. So those are very important to be aware of and to avoid if you can. Other lifestyle recommendations include ways to help the body detox, things like infrared saunas, Epsom salt baths, sweating, different forms of physical detoxification. And then supplementation becomes a very important component to treatment here. In particular, the right forms of vitamin B12 and folic acid, and they need to be in a methylated form. Those forms are much easier for the body to use and allow the enzyme processing to happen as they should. We typically here use a compounded formulation that gives the right amount and the doses that people need. In addition, vitamins like vitamin B6 and fish oil, curcumin, milk thistle, probiotics for the health of the gut, vitamin C, vitamin D are very important. And then there are several other potentially useful supplements that may be added as necessary, as needed, that help to improve the production of glutathione. One thing that is important to note is that patients or people that have a double copy of the C677T mutation are at much, much greater risk for blood clots and strokes and heart disease, and it's very important that the blood thinning is addressed. They need additional supplementation that helps with that, or even medication. Things like nattokinase can help with that, aspirin, and then prescription medications like Coumadin and Lovenox may also be in order, but that's determined individually given other health factors. In our clinic here at Piedmont Wellness Center, we will frequently test and find that a good percentage of our patients test positive for some variation of this mutation. Biggest thing we do is to educate and to really encourage you to take an active role in your healthcare and in terms of prevention. One of the interesting things about genetic medicine is it allows you to find things early and to really work toward prevention. And this is one of those genes where many things you can do can help prevent potential illness and disease. And then we provide an individualized treatment plan that includes these lifestyle and supplemental recommendations. And if necessary, we can do some further gene testing if that's warranted. I think at this point, if there are any questions, it would be a good time for questions. And, let's see here. Okay, I'm seeing one question up there, but now I've lost it. Let's see here. That there's conflicting information. That's a good question. My resources have indicated the same thing, that there is a particular group of research that says the A is significant primarily when it comes to neurological and mental health disorders, and the C variety is more associated with heart disease risk. So that in general, it should be treated the same way. And that is how I approach my patients. Knowing that the more severe mutation is the double copy of the C, then there are more recommendations for that mutation. But still, the methylated folic acid and B12 are very important. And then also to point out that with the mutation, there are certain conditions that make methylation or that impair methylation. significant illness or disease, mold toxicity, even Lyme disease, all increase the rate of methylation, and even in a healthy individual, methylation is impaired. So given the mutation of a single or even a double of the A1298, this protocol is still very important. Is a hetero? Yes, there are. I mentioned about 12 other mutations that are potential. There's the COMT, there's a whole list, and that I'm afraid I have not memorized. But when any of the mutation on the MTHFR is at play, there is potentially mutations in other genes. The way that you determine testing for that is if symptoms are not improved and you've done the basic protocol and put things into place, that warrants further test your genes to see what's going on. Any other questions? Oh, yeah, and if you would type the question on the left-hand side there, how do you determine if you are hetero? And I'm assuming that I can't see that. The test that we do typically through LabCorp tells whether if you have a single or a double copy or a combination of the A and the C together. So that comes out on the basic test that we do for that. I'm going to go back to the other question where that Gwendolyn asked about the 1298. It's interesting. I have several patients that are seen at Baptist in the genetics department, and they are told that the message is the 1298 is not clinically significant. But I'm not seeing that so clinically, and other research, like I mentioned, is saying that there is certainly some significance there. So if you're single, what are you, says Gwendolyn. It would depend on what the test reveals. You can be a single C677T or a single A1298C. Either of those can be single. And that means that the opposite allele is a normal MTHFR gene in both cases. So single just means you have one mutated allele. Any other questions? Yes, I'm familiar with the 23andMe, and it's a saliva test that you can send out that looks at the MTHFR along with other types of genetic predispositions, metabolism of medications, and that sort of thing. So that is an option for being tested. Okay. I'm a single 1298C, so am I hetero or homo? You are hetero. You're a single hetero. Homo means a combination, the same combination of both, and hetero is a single. Yeah, that language gets confusing. You're welcome. There is some difference, as Danielle is asking if this is different between races or in different populations of people. And there is some difference. In America here, we typically have probably the highest incidence, close to 40–45% of the population. But there is definitely, in Asians and Hispanics, there is, I think it's 20–30% presence of the mutation. But across the board, population-wide, it's 40%. There's a slight variation. Yes, I do review the 23andMe results. I'm familiar with that. I've done that myself personally. I'm familiar with that. With the 23andMe, I know that recently, I think in the past year, there was some FDA involvement where they didn't allow them to do some of the genetic testing, and you had to go into further sites and get permission, and I'm not sure where that is right now. Any other questions from anybody? Yes, I do work with children. As a family nurse practitioner, I'm licensed to work with infants through all ages of people. And I have a couple of children that I'm working with now that are known to have this gene mutation. Not everybody with this gene mutation is diagnosed with Asperger's or autism, but there is a connection there. But with children, when you know this early, so much can be done in terms of prevention and optimizing their ability to function and optimizing their health. So it's really important, if you know that this mutation exists in your family, to be treating your children. Other questions? Let's see. Let me think if there's anything else I can tell you here. At Piedmont Wellness Center, we do offer a free phone consultation. If you have any questions or are concerned that you may have this mutation, that consultation can determine whether you need to come in for an appointment or have the test done. We'll be glad to do that for you. There's much more information on our website. The phone number here, in case you don't have it, is 632-9944. But there's certainly much more information we can provide for you. Any other questions at all? Yes, Danielle was mentioning you can put questions on Facebook. We'll be glad to answer them there. Do you accept insurance? We do not accept insurance for our office visits because insurance, as everybody knows, certainly likes to dictate care, and we don't do that here. And it doesn't allow us to spend the time that we do with our patients, so we do not accept insurance for our visits. Some of the lab testing may be covered by your insurance depending on your policies or depending on how they look at whether or not we're in network or out of network for them. Okay, Sherry says, I found I had a single mutation about 5 months ago and have been trying to detox and have fatty liver. I don't feel I'm detoxing properly. Any suggestions? First of all, have you been put onto a protocol for the mutation? That's a very, very important piece to start with before you try to detox. If the cells don't have the proper amount of B12 and folic acid, they're not going to be able to create the enzymes necessary in order to detox. So that's the first step. Things really have to go in a stepwise fashion, or you can feel much worse before you feel better. So that's one thing I'd address. And then looking at some of the other lab values, how are blood sugar, inflammatory markers, or there is some issue with the liver in terms of liver enzymes, and are you doing some of the supporting supplements that help with that process of detoxification? So that's a really important piece. Any other questions? Lead detox. Okay, Gwendolyn says she's on a program and did a 6-month lead detox. Okay. Are you on the methylfolate and the methyl B12? That's the first question. Because without opening up the pathway essentially to the enzyme, you can't detoxify. So make sure if you're not on the methylated forms, that's a really important piece. And another question from Melody, where are infrared saunas around here? That I'm not sure. I know that there are some clinics or gyms that offer infrared saunas. You can personally buy them. I have one at home because my family has many variations of the gene mutation, so they are available for purchase. Okay, Gwendolyn says she is on the methylated forms. Okay. Then you want to look at some of the supporting supplements that you're using, and you may need to be looking at how to supplement with glutathione, which is not an easy thing to supplement with, or things that create a better production of glutathione, like N-acetylcysteine. That's a supplement that may need to be added. And additionally, if things are not improving, some of the other genes may be at play here, and that might have to be tested further. Let's see here. The next question, you should, some medications that should be avoided. Is that available online? I'll be glad to put that online for you. There are several medications that should be avoided because they block folic acid. And in addition, I'll add to that list that there are some things that increase the methylation process or seal methyl groups essentially and need to be avoided as well. The folic acid and folate. Yes, the difference in those two is that folic acid is synthetic. It's what is put into foods and into grain foods. It's put into vitamins. Typically, vitamin supplementations use folic acid. Folate is a more natural form. Typically in foods, it's found in uncooked leafy greens, and you get the proper kind of folate there from food. So that's an important distinction there. But in terms of supplementation, you want a methylated form of folate, not using anything that just says folic acid, or for that matter, folinic acid. What detoxing actually does. Okay, what are you detoxing from? That's a good question. I guess from the minute of birth till the day we die, we're breathing and taking in different chemicals, different substances that are hard on our body. Typically in America here, we are exposed to air pollution. There's contaminants in water. Food is loaded with colors and dyes and different chemicals that the body's not sure what to do with. So the cell naturally has the ability to detoxify, but when the gene mutation is present, it can't do that. So think of detoxification on a much smaller level cellularly. So each cell has to go through its own process of detoxification. And that it has to identify a foreign substance, it has to do something with it. And when it can't do that, it either has to store it or it simply slows down the function of the cell. So certain things like heavy metals, mercury, lead, for example, those are metals that the body doesn't handle well. And then bacteria and viruses also are toxic substances. Chemicals that we breathe in the air, they are foreign substances that the body has to deal with. So that's what it means in terms of detoxification. And that's your cell has to open up that pathway in order to do that. And then those toxins are eliminated via the bloodstream and the urinary tract and leave the body. Yeah, that's essentially what detoxing means on a very, I guess, cellular level, if that helps. Any other questions? Yes, we can add, and I can add some further information and some good references for you to get more information on the gene mutation. Okay, a question, if somebody has a thyroid or adrenal issue as well, what do you treat first? It sort of depends on the severity. If thyroid function is very, very impaired, we start with both essentially, because you have to treat the thyroid gland. But we also will put you on the protocol for the gene mutation, including dietary changes as well as some supplementation. And remembering that with thyroid disorder, there's huge impact when it comes to diet and supplementation. So all of those things need to be optimized for the cells to function the best. Now, thyroid dysfunction may be coming from a toxic situation, and then it would improve with the process of detoxification and improving your cell function overall. But it sort of depends on the individual and what's most pressing in terms of symptoms. But they can be addressed together. Other questions? Yes, you should avoid wheat. Wheat, again, being one of the highest fortified grains that there is. I'm an anti-wheat person anyway, but for the sake of its fortification, that's the type of folic acid in particular that someone with this mutation cannot handle. And recently it's been in the news that folic acid is associated with cancer. And one of the reasons for that is that it's in a form that stays unmetabolized. That is directly related to the risk of cancer. So we fortify grains in particular, so that it includes rice, it includes wheat, it includes spelt, oatmeal, processed foods that are fortified with synthetic vitamins, all should be avoided. Yes, you can avoid a lot of folic acid by avoiding processed foods. The more you adopt it, I'm going to call it a grain-free or a paleo type of a diet, real food, whole food that you recognize, you're going to eliminate that type of synthetic or unusable form of folic acid and B12, for sure. Those are good questions. Any other questions? Yes, in pregnancy, that's, again, one of the recommendations is to be screened before pregnancy occurs so that you can make sure there's proper supplementation during the prenatal period. The need for the right type of folic acid is crucial for the neural development for the baby. And so, yes, it's extremely important. When I'm seeing anybody new in the clinic, somebody who may be engaged, who's in their 20s, who's having significant symptoms, we're going to go ahead and test no matter what, just because it's a good time, particularly in women. And then when couples come in together, it's completely important to be testing both partners. Yes, the folic acid does do harm. That's many of my patients ask that, can they keep taking a multivitamin that has folic acid? The synthetic folic acid does do harm. That's because it stays in an unmetabolized form, and the cell can't eliminate that. So there is an association, again, mostly with cancer and unusable folic acid. So yeah, it's a matter of trying to eliminate. Good questions there. Any other questions? There is a particular website that probably I found to be the most comprehensive. It's MTHFR.net. And this particular practitioner has basically dedicated his career to researching the gene mutation. He provides all kinds of updated information. It's a very, very excellent source for anybody who has this mutation as a resource. And we'll be sure we put that on our website as well. Yep, it's Ben Lynch. Yes, it is. What's that? Our web address. What is it? Our web address, let me tell you, it's PiedmontWellnessCenters.com, and you can find information there. And yes, it is Ben Lynch. He's an awesome resource for this gene mutation in particular. Any other questions? One of the things that you'll encounter, and I've encountered this clinically in the past 6 years, is that not all practitioners or specialists are familiar with this gene mutation, and many do not understand it, they don't think it's important, and they sort of disregard that it has any impact. But my patients are beginning to educate other providers, and I think within time it'll become much better understood. I have had a few patients that are being seen in psychiatry where it has impacted the treatment that they receive, and so it's been a very positive change. Can you get too much folic acid, or does the body just get rid of it? You can get too much folic acid too quickly when you have this gene mutation, and it causes a situation of over-methylation. A lot of times we think, well, if a little is good, more is better, but in the case of this gene mutation, that's not quite the case. You have to sometimes gradually increase the amount of folic acid, or people feel worse before they get better. And so so yes, you can. It's not a toxic vitamin in that sense, like some fat-soluble vitamins can become toxic, but it's not going to make you feel good. We'll put it that way. The next question from Dawn says, I know that wheat is bad for us, but is it common to have other severe food sensitivities, or is that most likely due to the inflammation? Are you asking whether wheat is the issue of food allergy, or is it because wheat causes inflammation? The issue with wheat is multifactorial. It's typically a genetically modified food, so we don't really know the impact of that just yet. It's highly inflammatory. Wheat contains numerous nutrients. So your body, it blocks your body from absorbing various nutrients and minerals in particular. It also spikes blood sugar very significantly, even worse than a candy bar in some cases. So wheat has numerous issues, even if an outright allergy is not present. So all good questions. And nobody wants to hear that they can't eat wheat because it's so common in our diet, but it's really not a good food. How do you feel about ancient einkorn? Good question. If you can find it, it seems to have less of an impact on blood sugar, seems to be slightly less inflammatory. There have been some testing different people have tested using einkorn wheat and have shown just those things, that the spike in blood sugar is much less. There's a website for it, Jovial Foods. Okay. I had heard that it was very difficult to find. It may be better, and again, this is going to be individual, because even slight spikes in blood sugar are not okay for people that have diabetes or blood sugar metabolism problems. So it's still a significant consideration there. And there may be an allergy to the gluten or the gliadin, even in the einkorn wheat, even though overall it may be a better source. So it still becomes an individual question there. Good. And you've been doing good with it. That's awesome. Low gluten. Good. And again, remember that wheat doesn't have only gluten and gliadin. There are about 26 or 27 different proteins that the body can be sensitive to. And typical allergy panels only test for those 2 proteins. So there may be some other issues in those types of wheat that people can potentially react to. But that may be an option for some people. Any questions other than those? Okay, let's see. Okay. Yes, we will post more information and a couple of resources here. We'll kind of recap some of the questions and the information. And I will provide you a little more information on some of the other genes that are potential players here that may need to be tested, and some resources that you'll find for those. Thank you so much for your attention, and we'll be glad to consult with you if you need. Please see our website. Feel free to call the office and arrange for a consultation. But we look forward to working with you. Thank you. Yay.